All right, welcome back to Paging America, where we explore the power, profit, and politics shaping American healthcare and what you can do about it. I'm your host, Miles Baker, along with Dr. Rob Davidson. Dr. Rob, how are you doing today?
I'm okay, Miles. How you doing?
I'm pretty good. It's, the city of Chicago. A lot of people think it's cold. A lot of people think it's snowy. I think those people are wimps. But there are 5 days a year where I say, this is a little too much, and we are on day 2 of our 5-day allotment today.
Really?
So,
I mean, but you come from pretty hardy stock, right?
Sure,
Way up
still,
in the Upper Peninsula of Michigan.
It is a chill that seeps in your home and your bones, but we're doing fine. Otherwise, it's lovely to be here. So,
not to paint with too broad a brush, but I lived in Chicago in college, did some research at the School of Medicine and Stretch School of Medicine out in Maywood. And I remember and this was recounted to me from people who lived in Chicago at the first snow, first sign of winter. And then every time it thaws and another snow comes, people in Chicago kind of forget that they live in a northern city. And it's everyone's just looking around and I get it. If you get snow in Atlanta, that's a crisis. 2 inches of snow, you shut down the schools. It's winter up there a lot.
I think a lot of those people are new people. I think if you've been here long enough. No, I mean, it's some people for sure. And the way they drive is bananas. But I personally love, you're familiar with the concept of dibs, where if it snows and you dig out your car, you can put a folding chair where that car used to be, and you better not take it, or you might experience something bad.
Yeah.
And
that's the Chicago way.
Yeah, it's a great system, and I think other cities should adopt it. I find it to be extremely equitable.
I think it's one of the only big cities in this country where maybe Minneapolis, where you get that combination of big city grit and sort of Midwest nice, so that's kind of nice. Yeah, I was just thinking, and I haven't asked you about this, how you guys are all doing with flu season. I've not managed to avoid it. Even seeing patients, man, I'm masking up. I don't care if you've sprained your ankle, I'm masking up because I don't want to get your stuff and I don't want to potentially give you stuff. But I've kind of skated through this so far. It's been pretty nice.
Yeah, flu season's been really bad in Chicago. They were hitting some record numbers. We actually had to take a trip down to the pediatric ER, and we were told to go, because we were not there for the flu, we were told to go to a different room because of all the hacking and coughing and vomiting that was happening in the main room. and they were like, you should head over there.
Yeah.
So we did that, and we thankfully avoided it, and I'll knock on wood too. But so
good deal. Well, let's get into it.
Okay, let's get right into it. We got a big show for you today. A number of different topics we're going to cover. On the back half of the show, we have Dr. Chelsea Daniels from Los Angeles, who's coming to us as a family planning doctor working with Planned Parenthood. She's got some insights on the latest developments in reproductive health news. So we're excited to talk to her. She's always a great chat.
Yeah.
But in the first part of the show, we're going to be covering the HELP Committee's hearing on chemical abortion. An update, some positive updates on the Nevada public option, the status of the House's ACA healthcare subsidies, HHS, and their sharing of data with ICE, and the Trump administration's abrupt reversal on cutting funding for mental health and addiction programs. So a lot to cover, and we'll get right into it. I'm going to start with the Senate Help Committee, since that was just yesterday, January 14th. The Senate Health, Education, and Labor and Pensions, most commonly referred to as the HELP Committee, led by Louisiana Senator Bill Cassidy, our favorite, held a hearing deceptively titled Protecting Women, Exposing the Dangers of Chemical Abortion Drugs. The HELP Committee's announcement of the hearing describes mifepristone as a dangerous chemical abortion drug, despite decades of safe use. We've covered that on this podcast. Mifepristone, extremely safe. The Republicans seem to be increasingly obsessed with it. Here's how Miss Magazine characterized the performative hearing. Rather than offering new evidence or legitimate oversight, the hearing played out exactly as reproductive health experts warned, a partisan exercise in recycling debunked claims, elevating junk science, and laying the groundwork for further restrictions on the most commonly used abortion medication in the United States. The ongoing efforts attacking mifepristone, used in over 60% of all abortions across the country, continue to be based on a self-published position paper from a far-right organization that has been thoroughly discredited for its many, many, many flaws. Prior to the hearing, Washington Senator Patty Murray issued a statement saying, "We all know this hearing is not about the actual science or the facts, certainly not about what's best for women's health. The hearing is really about the fact that Trump and his anti-abortion allies want to ban abortion nationwide, and medication abortion is the most common method of abortion in the U.S. So that's what they're going after.
Yeah.
Yeah, so we've covered the number. They're attacking sort of medication abortion 3 different ways: through congressional hearings, through an FDA safety review process, and in the courts. This was a real circus yesterday, though, Rob. Like, you would have to be either a far right partisan Republican or very gullible
Yeah.
to not see what the Senate Health Committee was up to in creating sort of propaganda through the committee process. I don't know if you have a reaction to it.
Yeah, I mean, Trump's been a little squishy on this, right? And I think to the dismay of a lot of sort of far-right anti-abortion activists and people in Congress. And so who knows, like, is this for an audience of one, you know? I mean, to kind of get into his brain, his addled brain, and create, you know, some uncomfortable tension. This is particularly troubling for me. I was actually part of a press call kind of the day before this, talking about this with other docs and experts around the country. And for me, I work in rural areas. Like, I have my whole career. I continue to do so, both, you know, at actually now a few different jobs doing more to sort of travel local medicine, but all in these rural places. And in a lot of these rural places, your only access to many aspects of healthcare is telehealth, right? They just don't have providers. I know up in the Upper Peninsula, where I've done a little bit of work. I mean, this is like rural, right? Like, this is some of the most rural spaces in this country. The last place where women could go to get abortions in Marquette, the Planned Parenthood clinic, closed in April of last year, now 2025. So the only ability of people there, if they were to have to go in person, would be going to like Green Bay, Wisconsin, or going down, you know, below the bridge, which a lot of Yoopers aren't super crazy about, but, you know, just a lot of tension. And the only way they could exercise their Michigan protected constitutional right to have an abortion is through mifepristone, through the abortion pill, through telemedicine. Like, that connection, I think, for rural folks is so obvious, so strong. You know, this is obviously, like you said, a partisan exercise, but it's still dangerous, right? Because we know from recent polling that there's sort of a lack of knowledge in the general public about mifepristone and how extremely safe it is. And so the more they throw out there to muddy it up, I think it just makes the job harder for those of us just looking at the reality of what mifepristone is and what it provides. And it's really like the bullshit of Dobbs and saying, well, you know, leave it up to the states. That's what they're specifically trying to not do now, leaving it up to the states. It's just
that's right. Is they're trying to that seems to be the case, is that once all of their states have banned it, then they can start reaching beyond the borders. We'll get more into that a little bit later. Yeah. You know, the thing that really struck me is during the hearing, the thing that stood out to me is the obsession with gender politics.
Yeah. From
some of the Republican senators, that this was a hearing about mifepristone and the safety of the wrongly and sort of as a ruse, pretending that it was about the safety of mifepristone, but they couldn't help themselves going after trans people. They were it was like they like glitch out and they can't not talk about it. It's such a strange obsession. And, you know, they think they're scoring political points off of it, but it to me, that spoke to the corruption and the silliness of the whole process, that it is such theater, and that it's using government processes and what should be a legitimate process to come to good public policy outcomes in order to create propaganda that wasn't even on the topic of the hearing. So,
well, it's become a party of clickbait, right? And content creation and juicing the algorithms, right? That's what their party is. They don't legislate. They certainly don't provide oversight to the administration in any way, right? Let alone any meaningful way. And so that's all they can do, right? Is just sort of try to juice people's algorithms with content. And this to them is something they think is clickbait for folks that are aligned with how they look at the world. A sad use of of time in a committee. Like, there's a lot going on, right? Help committee could be talking about Medicaid cuts, could be talking about the ACA and funding that, right? Expanding healthcare, vaccines, right? These are things they could and should be talking about and holding people accountable on. Instead, they use it for this. It's, shame on you.
Yeah, the Senate Help Committee.
Dr. Cassidy.
Yeah, Senate Help Committee is one of the most powerful committees in the Senate, and it seems like it has been repurposed for Instagram content.
Yeah.
Too bad.
Yeah. Yep.
So Help Committee for the Gram. Anyway, we'll bring more on that as an update. Hopefully that's the end of these sham committee hearings on mifepristone, and they can move off the topic shortly. We'll stay on top of it if they don't. I have some good news, Rob, out of the West. Some good news out of the states. Often when the federal government is as bleak as can be, we get some good news out of the states. The Nevada public option is now operational. A little background: Dr. Davidson and I worked on trying to pass the Nevada public option, mobilizing physicians across the state of Nevada. Some real heroes, the doctors in Nevada who worked on that. But it's taken several years to come to market, as they say, particularly because the current governor was not particularly keen on it, but he was kind of boxed in by the good job that Senate Majority Leader Nicole Cannizzaro and the other legislators in Nevada, they kind of boxed in the governor. So they basically had to go eventually do this. So they slowed it down, but they eventually had to bring the public option to market. So in 2025, Nevada secured federal approval for its battle-born state plans, a state-level public option for health insurance that began operations on January 1st of this year, 26. The deadline is to sign up for insurance for 2026 is today, actually, January 15th. And as of January 6th, about 20% of Nevadans who actively selected a healthcare plan through the state's marketplace chose the Nevada public option, Nevada HealthLink. With the expiration of the enhanced ACA tax credits and the average premiums in Nevada jumping 26% this year, timing could not have been better for Nevadans. And some early analysis seems to suggest that the public option not only held the price down of the public option, but it held the price down for options that weren't the public option, for plans. So pretty good outcome for.
Pretty good.
And the Nevada insurance market is an interesting market. It's because of the density of the trade unions, the culinary union, but other unions in the state of Nevada. They have really, for lack of a better term, sort of premium healthcare plans in a lot of places. So the insurance market is really different. Plus, Nevada's a really small state. So a lot more people than usual have these really high-end employer-based plans. Even working class people have sort of these higher-end plans, but there's still gaps in the market. So it's kind of a different insurance market than other states. But you're even in that sort of interesting situation in Nevada, you're seeing the Nevada public option really attract market share. So anyway, what are your thoughts, Rob?
Yeah, I mean, if you remember when the ACA was being discussed back, in Obama's first term, the public option was on the table at one point, right? And then it was off the table. And one of the criticisms of the public option from folks was, well, how on earth are you going to have the public option? Insurance companies can't compete with that, right? And like some of the argument was, yeah, that's the point, right? This is a better option for people. And I think it's really important what you said. And I think it also speaks to the idea that how powerful a public option can be. I think some folks on the left poo-poo a public option. It's like, it's incremental. It's not enough. And we need universal health care, and a public option isn't that, right? Not 100% of Nevadans don't have health insurance right now.
That's right.
But what it does, right, it gives a bunch of people a cheaper option that's good insurance. And it also is a competitive force in the overall market, right? And so, I think it's a powerful tool. I think other states need to look at it. I think we cannot give up on this idea at the federal level of having, a federal public option. I don't know what the politics are of that. I think they're probably still pretty challenging. I mean, right now they're impossible, obviously, but even future state could be challenging. But I think this is a nice proof point to say, hey, man, this is actually making a meaningful difference in people's lives. That's the exciting part. Like when we got into this 5 years ago now, we were working on this in Nevada with a big coalition of folks in the state. It sometimes is painful to have to wait 5 years for some change to happen. But for the people it's happening for, this big deal. It's pretty good stuff.
Yeah, it's a big deal. I will say this, for those of us who are involved in the practice of passing healthcare reform or working on healthcare reform solutions, and particularly for those people working on the policy solutions, which we don't really do. work on after the policy's done, we try to pass it. Policies have to work faster. If Democratic healthcare reform is to be taken seriously, that the results have to get to people on timelines that you can work on. And 5 years is too slow. The Nevada public option is an incredible experiment that seems to be working, but in the future, it needs to work a lot faster if people are going to trust it. There's nothing durable about this stuff if it takes too long, whether that's prescription drug reform or insurance reform.
Well, the Medicare drug prices are coming down now, right? As a result of the Biden administration's work. And Trump's taking credit, right? Trump's taking credit.
Same diff. Yeah. So anyway, kudos to everyone involved, advocates, physicians, legislators, everyone who worked on the public option for so long, that we're starting to see success in the battle-born state. All right.
Yeah.
Let's move on to the House, Congress. The House and Congress passes a 3-year extension of enhanced ACA healthcare subsidies. Last week, the House voted to extend the ACA enhanced tax credits that expired at the end of 2025 for 3 years. A surprising 17 Republicans joined Democrats in passing the measure, which now heads to the Senate. Politico called the defections a stunning rebuke of Speaker Mike Johnson and President Donald Trump. One Republican senator, MAGA-aligned Bernie Moreno of Ohio, isn't giving up on the healthcare plan, that the healthcare plan could win 35 Senate Republicans. I doubt it. And a majority of Democrats. However, a vote in the Senate has been postponed until the end of the month. A bipartisan Senate group working on the compromise deal to revive the lapsed Affordable Care Act subsidies won't have legislative text ready until the last week of January, according to one of the lead negotiators. A dip in the cautious optimism some lawmakers have projected in recent days that a framework could be done or could come out as soon as this week. The nonpartisan CBO estimates that if it becomes law, it would increase the number of people with health insurance by 0.1 million by 2026, 3 million in 2027, and 4 million in 2028, and 1.1 million in 2029 relative to the current law. So I find just my back of the envelope math, like drop 20 million people off the rolls over several years. And then we're going to add 8 over the course of 4 years. So we're going to drop 20 off and then try to add 8 back and call that why don't we just keep it? Why don't we just keep it the old one? Anyway.
Well, and if they get to a point on this, right, where they pass something, right, just something that helps some people, because I still get to the on the ground reality, even 0.1 million people, that's 100,000 people that in their lives.
It's an incredible amount of people. Yeah.
But if they got to this point, why the fuck did we sit around all of 2025 doing absolutely nothing and put everyone through the chaos, right? That is the reality of the Trump administration, of this Republican Congress, of Mike Johnson's tenure as Speaker. It's just absolute chaos. And then, again, it's not worse policy-wise, but sort of as a practice of politics and legislation, it's almost worse to get there super late when you look back and say, wow, we could have been here in June of last year and this wouldn't have been an issue. What the hell, people? I don't know. I don't know if you have any thoughts on that, on the political or legislative side of things, how these guys operate.
No, I think some of the Republicans know that they're, in trouble on the healthcare issue specifically. And if they had not taken an axe to healthcare, would they be in trouble? Would people blame Congress for tariffs? I mean, we're looking through the various things that are extremely unpopular. I don't think people blame Republican congressmen for ICE. They should, but I don't think they do. But they do blame them for healthcare. And so I think they're treading water right now and on their way down. It is like a desperate last ditch attempt. I'm going to make a prediction, Rob. I don't think they get this done. I don't think it gets anywhere close to getting done.
Yeah.
I think it would be good if they. It would be good.
Even 0.1 million, right? Would be better than any amount.
Not
0.1 million.
I mean, I have a very clear opinion about this. Is we should try to get everyone healthcare, literally every single human being. And if we can't, we should try to get as many people healthcare as possible in the interim time, right? The 0.1 million people who got that healthcare wouldn't be sad about it. But it's not. I mean, I don't see their coalition working in a way that they're able to get the votes. And you could see the madman grandpa vetoing it.
He said he would, right? There's been reporting that he would veto, or who knows? He said both.
He's said both. He's literally taken both sides of the issue. So like it all kind of depends on if he's, got low blood sugar or whatever when the bill gets to his desk. So
and even if you look at Bernie Moreno's back of the napkin math on this, 35 plus half of the Democratic coalition, that's right on the edge of the 60 votes they need, right? Half of the Democratic, majority of Democrats is 24, and then another 35. You're at 59. I mean, they're plus minus getting this thing through the Senate.
Yeah.
That's crazy. That's crazy. That's where we're at. So yeah, I think your assessment that these guys actually pulling something together they can get past pretty low light.
And I just remember like the 17 Republicans who are, it was 17, right? Yeah. The 17 Republicans who defected on the ACA vote had real consequences inside their coalition.
Oh yeah.
A lot of those folks were marginal people, right? So they want to say that they voted for healthcare in their campaigns. They immediately had their support pulled by, someone fact checked me on this, by the Koch brothers network, the Americans for Prosperity, who I know, like we got the second Trump and we kind of forgot that there are other extraordinarily well-financed, really bad actors in the American political system because Trump sucks the attentional oxygen out of the room. But yeah, we have the Koch brothers network, Americans for Prosperity, just pulled their support. And as soon as they voted for it, it's like, all right, so what are you guys doing now? You're not going to play in the marginal races and you're going to penalize these folks for taking a position that, anyway, so like there's
they're
like,
doing to save their political lives. Like, let's not pretend that Josh Hawley really gives that. I don't know where his heart is. He certainly knows he's at risk, right? Folks like him in those districts. It's a political calculation, it would seem.
Yeah, but there's material political support gets yanked for folks when they show any inclining, no matter how not viable it is, to pass healthcare. And that's not an excuse, by the way. That's just an explanation.
Yeah.
All the Republicans should vote for healthcare.
For sure.
Okay, on to the next one. So federal judge rules that HHS, this one is the thing that's really pissing me off, and it's relevant to the news up in Minneapolis, as we've heard reports, on the ground reports, that ICE agents are starting to go door to door, which I think is got to be one of the scariest developments that has happened in the United States in decades, if not maybe since Vietnam. Maybe since Vietnam have we had something that is so absolutely bananas with the security apparatus, some security apparatus country interacting with the people who are not involved in the military and not involved in police forces. So the federal judge rules that HHS can handle over data to ICE for immigration enforcement. So at the very end of 2025, a federal judge ruled that the Trump administration can resume sharing location data about undocumented immigrants receiving public health insurance benefits with immigration and customs enforcements starting this month. So that's not location data like your GPS. That is, you fill out a form and send it to the government to get health care. And then that from the state migrates over to HHS or into the federal government. Now the federal government is walking that information over to ICE, and ICE is presumably, we don't have confirmation that they've used it, but presumably they're getting addresses of undocumented immigrants and using healthcare data to go hunt them. And I think that is, and it's all, this is the craziest repurposing of data that we know about. That's coming out of the federal government. There's plenty of the data that's getting repurposed that we don't know about, I suspect.
For sure.
But so just a little bit more on this. The decision marks a significant setback for California Attorney General Rob Bonta and 21 of his Democratic counterparts who sued in July to prevent the Trump administration from using Medicaid data obtained from the Department of Health and Human Services to target immigrants. A spokesperson for the California Department of Justice said after the ruling that people signed up for the state's health care program with the understanding that the personal information would not be used for immigration enforcement, of course. And the Trump administration's effort to use Medicaid data for immigration enforcement is a violation of their trust, will lead to fewer people seeking vital health care. I think that's the probably most important part, is people are not going to give healthcare. People are not going to interact with the healthcare system or with insurance if they think that data is going to be used to come and hunt them and their family. And although undocumented immigrants are not eligible to enroll in federal Medicaid programs, California, Illinois, Colorado, New York, Washington, Oregon, Minnesota, and Washington, D.C. allow some people to receive state funding benefits through the Medicaid implementation programs, regardless of their implementation status. Honestly, and I know that they're like on the far right, that there's going to be people who like they're taking, remember, a lot of times immigrants pay taxes. And also everyone should have health care.
Yeah.
So it's like not that controversial for me. So
no, I don't think we have to
what-
parse any words about this.
Yeah,
everyone. I don't care who the hell
that's
you are,
right.
where you're from, or why you're here. I mean, this makes me think of a guy I saw. This is going back a couple of winters, with just a recurrent respiratory illness, who's primarily a Spanish-speaking individual, right? So everything goes through an interpreter. So it makes it a little more challenging to get info. But someone who was really, really not providing a lot of information about sort of where they live, like I think it was a P.O. box and all that. And we kept giving information on following up at a clinic. And every time, and I think I personally saw this person at least 3 or 4 times. And every time it's like, oh God, we gave we got a refill of this, we did this, and we were providing the primary care for that person, and they just weren't going to this place where we said, hey, this is where you can actually get this all taken care of. And I have no idea this person's status, because we don't ask that. That's not my business. But I have to imagine this person is sort of not real keen on interacting with the system. And that's just, it's really scary that should be people's reality now, right? Like it's a scary prospect to think this is what they're doing with that information when it's really intended to provide people with health care. I think that's the worst outcome of this. And fucking door to door and ripping people out of their houses. Like, Jesus.
I think it's evil is actually what I think it is.
Yeah.
It's like, and I think it's one of the things that throws into stark relief for me, that when your mind goes to, is this sort of the darkest timeline in the United States? Are we really doing this? Are we contracting the social safety net to the scale of millions and millions of people no longer able to access benefits or healthcare, at the same time that we're repurposing the public health infrastructure or the health infrastructure of the United States into law enforcement, or worse than law enforcement, sort of the enforcement of some sort of racial regime or racial hierarchy.
Sure.
And it seems like that is absolutely what's happening. And it's also striking that the court said, go for it. Yeah. That's too bad. It's another instance of America sort of relying on norms instead of laws for so long, and then we get a particularly bad actor, and they come and demolish those norms so quickly. So
yeah, I mean, I was young I wasn't quite in healthcare yet, but I remember learning about this, about the time of the AIDS scare, right, of the 80s.
Yeah.
And people being really afraid of that, their status being revealed publicly. And I mean, we have HIPAA, right, so people can't tell medical information, but like that also should protect people's basic info they provide to us to be only used to provide them with healthcare, right? And yeah, the whole process.
In the ruling, that was part of the ruling, is that they didn't. So when they initially shared the data, now they already shared the data. So like
who knows what's out there?
I'm not sure exactly what this is in the future, I guess. And there's no penalty for actually doing it. But they shared the full data. And in that data, it sounded like there was health information. And then the court came back and said, you can share the location data, but you can't share the health information. So they're not, so like, say like, Rob Davidson lives at 123 Lane. Hey. And has a respiratory problem. They're like, no, you can say Rob Davidson lives at 123 Lane, but you can't share the respiratory problem. And so exclusively sharing the data with the purpose of going and getting those people. Right. So it's stuff. Really icky stuff. Okay. On to the madman, Robert Kennedy Jr.
Oh, Jesus.
He appoints additional anti-vaxxers to ACIP. In the last week, he had a big week coming out of the gate with the upside down pyramid and the
booze for breakfast.
Yeah. No booze for breakfast.
No booze for breakfast. Right.
No booze for breakfast. Okay. You could the rest of the day though. Have at it. Yeah. So RFK has appointed 2 anti-vax OBGYNs to the Advisory Committee on Immunization Practices, commonly known as ACIP, Kimberly Biss and Adam Orado. In a December 2022 podcast, Biss said, prior to COVID, I was not an anti-vaxxer, but I am now because I've gone down the rabbit hole, and I would love to be able to someday to meet Robert F. Kennedy. He's on ACIP now.
Wow.
In May 2023 panel discussion, she said her 2 grown children in their 20s received all their childhood shots, including for HPV, and that she and her husband routinely receive flu shots. My grandchildren will not get any shots if I can help it, she said. The vaccine industry is disgusting. Pharma is disgusting sometimes, but it's mostly the government affairs department. Anyway, we can get into that later.
Jesus.
During a December 2023 podcast interview, Arado said that he asked people to imagine a chemical manufacturing plant and a prenatal clinic outside the gates of the plant. The vaccines and drugs are coming fresh out of the chemical manufacturing facility, and then they're going into the prenatal clinic and they're being injected into the pregnant women, he said. This is a huge problem for us with just over-intervention in medicine. Too much testing, too many drugs, too many vaccines, Arado said in a June interview, later comparing vaccine makers to cigarette manufacturers.
Stop the testing. We're back there now. Jesus.
This is like over testing is actually a thing, right? Like sometimes,
yeah,
but yeah,
like the president getting an MRI or not an MRI, right? Or who knows, right? Yeah.
But then this continues to be the favorite tactic of these folks. Add something that has a little bit of truth, like a genuine problem that's being worked on, like a hard problem to solve that's being worked on, and then take something that's absolute horseshit and put it in as like an equivalent thing, and then say, let's throw the whole baby out with the bathwater. It's a crazy rhetorical tactic that they seem to all have learned from Bobby Kennedy, that they're all in on it. And that's too bad. So we got 2 more nutters on ASIP.
Like, I don't know the origin of the term going down the rabbit hole. I don't think it's a particularly positive one. Like, it seems like you are saying, hey, you went to some weird places that really probably weren't the best for you to go. And for someone to say, I went down the rabbit hole and now here's where I am, that's really striking. The other piece of this I think about, like, we fight, right, in our day jobs with the Committee to Protect Healthcare, we fight pharma all the time, like, right, trying to get prescription drug boards passed. And, like, pharma, they're pretty shitty in a lot of ways, right? They get way too many profits. They fuck people over that way. Guess what? I still take lisinopril for my blood pressure because I don't want to have a stroke. Yeah. I'm still going to take Crestor so I don't have a heart attack because my LDL is a little higher than it should be in my mid-50s. Guess what? We can still think that these guys making this stuff are pretty shitty, but also let's prevent cervical cancer by getting our kids HPV vaccines. And like creating that false idea that because some of the stuff they do is shitty, like you said, on the government affairs side and in the profit part of the business that they do, they're still Operation Warp Speed got us out of the COVID pandemic and saved millions of lives, right? Yeah. Getting that vaccine to market so quickly. I don't know, man. These people sound really kind of cuckoo bananas for me compared to even anyone else they put on there.
It's hard for me to get really fired up about these like Maha foot soldiers. Like, I really have antipathy for Bobby Kennedy, but like some of the weirder grifter sort of bottom rung newly appointed ASIP, they should be held accountable. But like, I can't get all that fired up about them. I am mad. You know what I'm mad about? In the list of things that I get mad at Big Pharma for is the fact that their government affairs department have such fucking poor behavior out in the public and do such dastardly things that are visible with the naked eye to anyone who can see that they've created this cottage industry. They've partly created this cottage industry of conspiracy theorists who are now driving down vaccine uptake rates because the Big Pharma is so hateable.
Yeah, right.
For their grotesque profiteering. It's a real problem. I still get more mad at pharma over the anti-vaccine stuff than I do the anti-vaxxers themselves, I think.
Because they created it, right? They
really
became the real villains. And so in that villainy, they've now dragged down the real benefit that is provided to society with some of the medications and certainly with the vaccines that they have brought to market and brought to us.
Yeah, they create this crazy backlash, and the backlash on the left is like, let's go regulate corporations. That's a little old, though. We've been talking about that for a long time, but the backlash on the populist right is like, kids shouldn't have vaccines. Let's bring back mumps.
Yeah.
Jesus. Yeah. Okay. Anyway. One more topic before we wrap, Rob. So Trump administration's abrupt reversal on cutting funding for mental health and addiction programs is In the news, so on Tuesday, HHS sent out a funding termination notice to around 2,800 mental health and addiction programs nationwide, effectively terminating almost $2 billion in funding, an extraordinary amount of funding for mental health and addiction services across the country. Like that, when we're talking $2 billion for the military, that's not much for the military. For mental health and addiction services, that's the ball game.
Yeah.
Funding a flurry of lobbying efforts and letter to RFK Jr. with signatures from over 100 House members, the funding was restored a day later with no explanation for the Trump administration. So the only explanation given for the termination of funding, done using a form letter from the Substance Abuse and Mental Health Services Administration, was that the service is no longer aligned with the agency's priorities of supporting, quote, innovative programs and inventions that address the rising rates of mental illness and substance abuse conditions, overdose, and suicide. The initial decision to cut the funding came at a time when nationwide fatalities from overdoses of opioids and stimulants have been dropping steadily since 2023. We've seen real progress in the United States of America under the Biden administration and then into the first year of the Trump administration on the reduction of harm from substance abuse and overdose deaths. And this would have been I think real bad. I think this would have had a really bad outcome. It's 2,800 entities that are providing that programming affected, but they walked it back. So we'll see if it holds. What do you think, Rob?
Yeah, I mean, Billy, you talked about in the military, right? So ostensibly they're talking about blowing up fishing boats in the Caribbean, to stop drugs from coming to this country, right? That is the sum of their justification for that. A, it's not the fentanyl that's killing people anyway. B, these boats couldn't make it to the
In
US.
the boats. Yeah, there's not fentanyl in the boats. Right?
Yeah, there's
cocaine.
no fentanyl in the boats. It's cocaine. But like how many billion, I don't know. This maybe is data we should have going in, but how many billions to bomb those boats, right? Versus taking $2 billion away from programs that actually have had meaningful impact on people's lives and saving. Yeah, it's critical. Again, in rural places. Jesus, this could have been
how much
devastating.
How many clinics per bombs? Can we get a clinics per bomb? Well, the next show, I promise you, we're gonna come ready with clinics per bombs ratios. How many clinics do you get per bomb? We're gonna run through that at the next one. It's madness that you're gonna put it. Hey, how many clinics do you get for moving an aircraft carrier into the Caribbean?
Well, yeah, that's right. The things you don't think about, just moving these people around. Jesus.
How much does it cost to put an aircraft carrier near Trinidad? Jesus. So, what? I'm glad they walked it back. I guess I'm glad they walked it back. I think, obviously, that pressure must have come from Republicans for them to walk that back. I think if Democrats were shouting from the rooftops, they probably wouldn't have. But
right, but the expectation they could potentially get away with this shit just by sending off an email to a bunch of programs, like that was their thinking. Wow, so much else is going on. We'll get away with this. Like kudos to the people in the clinics and the people getting this funding and administering these programs that clearly reached out to their representatives, right, to create this pressure point, because that's the only reason this thing happened. You're right, like. They did it. If no one had really noticed, and a couple of health reporters did a little something on it, like do we really expect this is something they would have turned around in such a quick fashion? I mean, again, the chaos with this administration, particularly with HHS and RFK, that seems to be how they operate, right? With chaos, and how many things are getting cut or going away that we're just not paying attention. If you looked in a few articles that were reporting on how this all transpired over the last couple of days, this is on the heels of like half of the funding to SAMHSA being cut, with Doge and other cuts already in the first year of the Trump administration, right? So this all has happened amongst so many other cuts that it probably flew under the radar, right? Where people weren't able to pay that much attention because of so much else going on. Good for those folks in those clinics and for the people they're taking care of.
Yeah. I find just one more note on this. I think there are a couple of Republicans in Appalachia and Ohio that actually care. And I'm not going to say their names because I don't know. I can't parse the ones that actually do and the ones that are ones that are just pretending to. I think the Republican Party's lip service to the opioid epidemic is one of the defunding of this stuff while saying that they care about it and coming up with like fake solutions, including bombings in the Caribbean, but other fake solutions that are not the way to work on addiction or work on overdose deaths and reduce overdose harm is one of the grosser things that the party has been engaged in for like 6 years now. I mean, the critique of Joe Biden and going after the Biden administration on opioid overdoses was all the time.
Yeah.
It was like a wall of sound out of the Republican Party, and just a few days after, actually they haven't even been in office for a year. So within the first year, they're looking at least attempted enormous cuts across the board in steep cuts for addiction services and mental health services across the country. Yeah. So just don't believe them. Just don't believe them if they bring it up again. They're full of shit.
Yeah, I mean, particularly the heir apparent to Trump, right? Like J.D. Vance, right? That's his pedigree, right? That's how he rose to prominence through. I mean, Hillbilly Elegy. If you read it or you saw it, this is one of his stories.
Or if you just put it on your bookshelf because you couldn't get through it because it was a bit of a tough read.
But like this is supposedly, right, like the everyman part of this guy, right, the number 2 in command, and kind of how they are connecting with kind of the everyday people. For the vast majority of the party, it's total bullshit.
Yeah. Yep. All right.
I just want to say one thing.
Yeah.
For people who are listening to this, like if just to subscribe to be able to see the video of Miles Baker's formulating a thought. Over the 7 years we've known each other, it's such an intentional looking up, and I'm always wondering, is there like a teleprompter up there, like with a Google search or something? It's really amazing. And then all of a sudden it's like, oh yeah, that's like a really good thought. I don't know. I appreciate that. It's something I've grown to like about you, and I think it makes for a good video. It really does. I got to tell you.
Okay. So Rob, I am using ChatGPT right now to try to figure out how much bombs cost in the Caribbean to see if we can. So dumb bombs are like $15,000, but if you're using anything that's precise, anything that, so like a tomahawk, I'm not sure if they're using tomahawks, but we're looking at 1 to 2 million per bomb. So usually
these are drones too, right? This is the drone program, right?
Okay,
going out.
Okay. I didn't know that. I know that they camouflaged a military airplane to look like.
Oh, jeez.
In one case, they committed a war crime by painting a military plane to look like a civilian plane, which is against I believe the Geneva Convention. If I'm remembering that correctly, we should fact check that. Yeah. So it's 2 million. So what, like a health clinic's average? I don't know what so like, what is a health clinic's average cost? We think like,
I mean, if we're talking 2,800 programs and $2 billion, right? That's less than $1 million per program. If we just do the napkin math and average it out, right? 2 billion divided by 2,000 would be $1 million. So we're talking every bomb that goes off could be a little more than a clinic that could have funded that, could have helped that, thousands of people. It's gross. If you put it all together, it's gross, and it just doesn't make sense.
Okay. So I'm a little off. So like a health clinic, like a really big health clinic in, say, like Cincinnati, Ohio. I picked that. I didn't pick that because that's why I picked it. So like it's about a 50 million. So like 20 missiles, more or less 20 missiles in the Caribbean is the cost of a clinic, like a really big clinic for like a major city. We're not talking like not like one, like a little one, but like a big one that services a lot of people. So every time you see a bunch of those bombs go off, so I guess, one missile. Anyway,
million here, million there. By the time you get done with it, we're talking real money.
You're talking real money. We're talking real money. Anyway, okay.
Right.
We'll veer away from that. We have an excellent guest up next, in Dr. Chelsea Daniels. So I'm going to throw to that, and we'll be back. We'll be back to read us out. All right, everyone, welcome back. Today we are very pleased to be joined by Dr. Chelsea Daniels. Dr. Chelsea Daniels is a board-certified family physician who focuses on family planning and reproductive health. She is a family planning staff physician at Planned Parenthood of Orange and San Bernardino counties. She's provided abortion care all over the country and is happy to be back in her home state of California after working in Florida. She was also a leading communicator on the Florida ballot initiative to try to secure reproductive rights in the Constitution of the state of Florida. Dr. Chelsea Daniels, thank you so much for joining us today. How are you doing?
I'm good. Thank you so much for having me.
I hear it is nice in California as opposed to what we're experiencing here in Chicago.
Yeah, I hate to brag, but it's like 79 degrees in LA right now or something.
Damn.
So yeah, I know.
Yeah.
I in fact have the window open because it's a little warm.
Yeah, we're all jealous. We're all
Yeah,
extremely jealous. So, Dr. Daniels, we asked you to join us today because there is a number of different developments, positive and negative, in the broader fight for reproductive rights in the United States. And as a leading advocate in one of the biggest battles down in Florida of the last election cycle, we thought we would love to hear a little of your perspective and reaction to what's happening in the news. But before we get started in sort of the day-to-day, I wonder if you could introduce yourself a little bit to our audience. So could you give us a little bit background maybe on how you decided to work in family planning and reproductive medicine, how you arrived at that career path?
Yeah. I get asked this question, I feel, all the time, and I don't yet have a succinct answer. I didn't have one specific light bulb moment. I think at some point when I decided that I wanted to go to med school, it was to be an abortion provider. So it kind of solidified for me that abortion was my calling. And I have worked in abortion ever since I finished residency. And I couldn't be happier. I just find it to be, it's like my lifeblood. It just is, it's what keeps me going. And I've worked in some pretty hostile states. I went from North Carolina to Florida.
Yeah.
Kind of all Perry Dobbs. And it unfortunately really pulverized me. So I came back to California after the loss of Amendment 4 in Florida. I'm still fighting, but the fight in Florida just became really, really challenging. But I'm happy to continue fighting in California.
Yeah, absolutely. So yeah, you found yourself both practicing medicine and being an advocate during post-Dobbs in Governor DeSantis's Florida, which was extremely hostile. And could you talk to us a little bit about what that was like, and then what made you decide to be such an outspoken advocate in the ballot fight in Florida?
Yeah. I mean, I think when I first moved, I was in Miami. When I first moved to Miami from Durham, North Carolina, it was probably a little bit of like naivete or hubris or something where I was like, yeah, I can do this. You know, DeSantis won't know what's coming.
Yeah.
It was really intense. I was there for a few years, and the kind of like the way that he really personally targeted the outspoken physicians was really, really scary.
Yeah.
Not from a personal safety perspective, but from a ability to practice, a professional perspective. So I think, yeah, it was a good learning experience, and it also made me realize that, you know, that he's a bully, and people like him everywhere in every state. They're bullies, and they, at the end of the day, they're insecure. They don't really know what they're talking about. They're coming from a place that's not founded in medicine or science. And I think what kept me going in Florida for as long as it did was this sense of like deep confidence that I and my colleagues did know what we were talking about, and we were doing the right thing for our patients repeatedly. Of course, Amendment 4 didn't go the way we wanted it to, but I think just that kind of deep sense of right versus wrong is what kept me going.
For those listeners who are not familiar with the ins and outs of Amendment 4, Amendment 4 did garner 57% at the ballot box. So it was
the majority, a
large majority in the state of Florida. But because Florida has a 60% threshold, it ultimately did not pass. I think one of the things that I found so surprising about Amendment 4, after, this wasn't surprising, that advocates like yourself, you and other physicians across the state were such powerful communicators in order to get 57% of the state of Florida on your side, very conservative state. Still 57% was on the side of passing Amendment 4 and putting reproductive rights in the Constitution. That not only did Governor DeSantis target providers as a sort of class of people, he did this sort of proto-Trump move where he started to repurpose the state's resources in order to fight the amendment. And I really think of that as ahead of its time. I mean, we see Donald Trump and we see the Trump administration.
He's a maverick.
Yeah, just totally innovated in terms of right-wing politics.
Yeah.
Is that he was repurposing public health dollars to actually run ads against the ballot initiative, which, at least in the North, would be extremely illegal.
The man was using taxpayer dollars to fund billboards on the side of the highway that I drove by every day on my way to work, talking about the fact that abortion was unsafe.
Yeah.
Taxpayer dollars for this.
Yeah. I think he did TV. He did something like many millions of dollars in television ads as well. It was an extraordinary amount of the state's public health budget that got repurposed into ads. And I still think
And
that there hasn't been a reckoning around that yet. I feel like I'm still like waiting for it. That
tens of millions of dollars also to crisis pregnancy centers. I mean,
Yeah.
there's no accountability, and I don't expect there to be in the
at least in the
near
short
future.
term, hopefully.
But yeah, in the short term.
Well, anyway, I thought it was an extraordinary thing that you and fellow physicians in Florida were able to accomplish by getting 57%, by getting to the majority, by showing a clear demonstration of majority support in the state of Florida. And it was too bad that it didn't pass, but it was still an incredible effort. So just to maybe dive into current news now.
Yeah.
Yesterday, recording on Thursday, the Senate Help Committee held a sham hearing on the quote unquote safety of mifepristone and other abortion drugs. Louisiana Senator Bill Cassidy, a physician, calls mifepristone a dangerous chemical abortion drug. That seems to be, they put chemical abortion on their signs now at the Right to Life marches.
Uh-huh.
What's your experience prescribing mifepristone over the years? Could you just speak for the non-physicians who listen to this podcast? Could you speak to the safety and what you think they're up to at the Help Committee?
Yeah, it's so funny. I was talking to my partner about the Help Committee last night, and my partner's a lawyer and very in the weeds with politics. And I was like, can we just take a step back and like, what is the point of these kinds of hearings and committees? And he was like, I mean, once upon a time in the 19th century, they were to, actually talk about real issues and inform the public. But now they're just
laws.
Yeah, to make laws. Yeah, do the things that are
Right.
appointed legislators. Right. And now they're just shams. And watching some of the clips with Dr. Verma, yeah, it makes my blood boil. But yeah, my personal and professional experience with mifepristone is that it is one of the safest medicines that I'm prescribing on a daily basis. I think more critically about who I prescribe Advil to than who I prescribe mifepristone to. And that is because the list of reasons to not prescribe Advil to someone, high blood pressure, heart disease, kidney disease, far outweigh the list of reasons that I wouldn't prescribe mifepristone. I think there has been one time in my career of the tens of thousands of patients I've prescribed mifepristone to where I was like, maybe you're not a good candidate. One time.
Yeah.
And I know that physicians listening to this is I'm preaching to the choir, but it's just such a silly argument that we even have to make.
Yeah, absolutely. For those who did, for any, for the 1.5 people that watched the Help Committee that are not on our team yesterday, It was really a show. It was really a bit of it was political. It was obviously political theater and not legislation that was happening.
Yeah.
Very frustrating for
It's
those
extremely
of us.
theatrical. Oh, yes.
Extremely theatrical.
Oh, yes.
I also, the Help Committee is led by Senator Bill Cassidy. He's one of our least favorite people on this podcast. We think he is this extraordinary coward, and we talk about it a lot, and we think we should talk about it since he is responsible just as much as anyone else for Robert Kennedy Jr. He's the senator from Louisiana, and an extraordinary amount of bad seems to be driven out of the state of Louisiana right now. Louisiana's getting is really shooting for the top spot in terms of states that are being bad actors in the union. So, but this past week, Louisiana Attorney General Liz Murrill indicted a California abortion provider in Sonoma County for mailing abortion pills into the state, and Governor Jeff Landry signed an extradition order. It's the second time they've done this. It was reported on extensively by the New York Times. If people want to read that article, we'll put it in the show notes. But the extradition order and the attempted enforcement action across state lines, principally from Texas and Louisiana, really gives me the willies in terms of, even back in the day, even in sort of old Jim Crow South, there wasn't a lot of attempts to go enforcement actions in California and New York and reach into the North. But it does seem like there's increasingly an appetite to try to reach across state lines. I'm wondering what your reaction is to that, Dr. Daniels.
I think on a personal level, I had this thought when I first moved from Florida to California about 5 months ago. I left Florida and saw California as this kind of like mecca. Like I can do my job here. And I think that anytime that there are cases like this, I'm humbled to be reminded of the fact that we are unfortunately living in a country where abortion is just simply not safe and protected in the way that it should be. And when you see these just pitiful, pathetic attempts by other states to try to criminalize what is basic health care and what I think we all know is basic health care, what all of the listeners of the show know is basic health care. It's just a big eye roll. It just makes me it's just scoff. It's so pathetic.
Yeah, it is. We did have a little. We had some courage out of Governor Gavin Newsom. We're seeing him continue to stand up to bullies trying to undermine rule of law. He said that California will protect patients and their doctors and will not be complicit in efforts to strip away their privacy, autonomy, or dignity. Do you think this tactic of one state attempting to go after physicians in another state will continue? Where do you see that? I mean, you've seen a lot and like have a time horizon that I think is useful for people in terms of the Republicans or GOP state legislators continually ratcheting up the pressure.
Yeah.
Do you see the trend continuing, or is this just to placate like a moment in time skirmish inside the pro-life right, and we might be moving on soon?
No, I think what concerns me and something that I think we are all thinking about is the fact that at least the current status quo and the current political landscape, this is just acceptable. This is normal. To go after physicians and patients. Maybe a little bit out of the scope of this particular conversation, but what happened to that woman in Kentucky? The case that I'm talking about where I think she ordered pills online and then buried the remains in her backyard and was charged with murder. Ultimately, the charges were dropped, but this just happened, I think, last week. People are unable to have the kind of personal privacy and dignity that they deserve when it comes to making healthcare decisions. And the fact that we're just seeing case after case after case of this, each one seemingly more foolish than the last, makes me think that we might not be anywhere near the close of this chapter. This be the beginning.
I think that's kind of where I land too, that the ratcheting up of they're not going to be satisfied. The zealots are not going to be satisfied, even if they get I think there's a thought in some of the pro-choice right that their far right flank and the pro-life flank inside the Republican Party, if they get like an enclave in the American South, that they'll be satisfied with that.
Never.
They won't be.
Yeah.
They're gonna.
And I also think that in all of our lifetimes we were kind of like wooed into the sense of security by Roe v. Wade, and we should have known better.
Yeah.
And now we're seeing exactly what happens when we're wooed into a false sense of security. So I feel like we just always have to be on guard by these morons who are just doing these heinous things.
Yeah, absolutely. Well, let's not end on a bad note. We have some really positive developments in the state of Virginia. So a proposal to guarantee abortion rights, it's facing its second round of votes this week, passed the House of Delegates for the second time. And with Democrats in charge of the legislature, the measure is all but certain to head to the November ballot. So they have this unique process where they have to pass it out of the legislature twice, and then it goes to the ballot. The people of Virginia will get to vote on a straight up or down vote on whether they secure abortion rights and reproductive rights in the state constitution. Looks like we're headed for sending that to the November ballot. I'm wondering, as one of the lead communicators and such a powerful voice in the fight in Florida that got 57% of the vote, is there any advice that you would give to the advocates who are getting ready for in the spring and summer of this year to have a big fight in Virginia to try to secure reproductive rights and secure reproductive rights in one of the only southern states that will have a constitutional amendment in Virginia? I'm wondering if there's advice you could give to those folks.
I guess when I look back on my experience, about the year or so leading up to the vote on Amendment 4 was really a really, really intense year, but it was so rewarding and felt so, so important. And so what I would say to all the advocates out there is it's going to be an intense year, but one you will never regret, especially because it's likely to pass. And it's the amount of, I think, sway that our words as physician advocates can have over voters when we can actually be the spokespeople for what's accurate medical science is huge. And we should really use that sway wisely and for good.
Great. I think that's great. Okay, Dr. Chelsea Daniels, thank you so much for joining us at Page in America.
Thank you.
We hope you'll come back soon. Your perspective is incredibly useful to the other doctors and healthcare advocates that listen to this program. So thank you so much.
Thank you so much.
Okay, Dr. Rob, another great show. Thanks for chatting with me today, and I really enjoyed having the conversation with Dr. Daniels. So
Yeah, thanks for doing that.
Hopefully
Always
we'll
great to
get-
hear from her.
yeah. So I'm gonna go ahead and read us out today. Today's episode was written by Chris Savage, Dr. Rob Davidson, and me, Miles Baker. It was produced by Amelia Dylan Schneider, Joel Bryson, and Chris Savage. It was edited by Darian Badigan. Our music is by Annette Somerset at Duneflower Productions. If you enjoyed today's show, please subscribe and leave us a rating on YouTube, Spotify, Apple Podcasts, or wherever you listen. Your support helps others discover the podcast, and you can also follow us on Paging America on Substack. Physicians, your voice matters. Join the fight for better American healthcare by becoming a member of the Committee to Protect Healthcare. Visit www.committeetoprotect.org to learn more. And Dr. Davidson, I will see you soon.
See you next week.
Chat next week. Bye.